Men, your first line of defense isn't a pill, it's your skin. Is it bright or dull, smooth or bumpy? If your skin is whispering about HIV, are you listening? Not every red patch is an allergy. Sometimes it's an early clue. Thrush that keeps coming back, greasy flakes across the face and chest, thick, stubborn warts, or sores that won't heal. Patterns matter, especially when they repeat. Here's a truth most guys never hear. About 90% of people with HIV develop skin changes at some point, meaning the skin often speaks first. Tonight, I'll teach you a 60-second nightly skin check that replaces fear with clarity. We'll look where men forget to look, and I'll show you how to log 3 quick notes so your doctor can act fast. I'm Dr. James, a urologist focused on HIV prevention with over 20 years in U.S. clinics. If this matters to you, subscribe and comment "I'm listening" so I know you're here. Stay to the end, and I'll reveal an inside-out habit that makes your skin look alive while it protects your health. Let's begin with why skin so often speaks first. 2 weeks ago, a 25-year-old walked into my clinic and said, "Doctor, my skin has never behaved like this. Should I be worried?" I glanced once, asked 3 questions, and could already see 90% of the picture. Here's the short version in plain language. HIV lowers your CD4 T cells, the coordinators of immune defense. When CD4 drops, the skin's barrier and patrols weaken, so opportunistic infections, yeast, viruses, bacteria, even mites, show up earlier on your surface than they do in blood work or scans. That is why I call skin a mirror of immunity. It reflects internal trouble long before the engine stalls. Recurrent oral thrush that resists routine treatment, diffuse greasy flaking across the eyebrows, beard, scalp, and chest, cloudy patches that look lighter or darker than the surrounding skin, or explosive folliculitis. These are gentle alarms, not random quirks. Clinically, patterns matter more than single episodes. If something returns, spreads, or stops responding to over-the-counter care, it earns your attention. It does not mean HIV for sure, but it does mean the responsible move is to test, treat what we see, and keep you safe while answers come back. Think of your body like a dashboard. Before the red light flashes, a yellow light blinks. Skin is that yellow light. It is visible, trackable, and, if you know what to look for, actionable. That is how we avoid emergency lanes and keep you moving forward with confidence. Back to my patient. He had persistent seborrheic dermatitis on the face and chest, a white film on the tongue that did not scrape off easily, and clusters of inflamed follicles on the thighs. We tested on the spot, treated the skin, and set a follow-up plan with clear checkpoints. Why do I tell you this? Because once you understand the mechanism, you can stop guessing and start observing. You can use structured notes, catch recurrence early, and walk into a clinic with clarity instead of fear. You now know the why behind the signals. Next, let me show you the hidden root causes that make American men miss these clues, and what to change so you never repeat that young man's story. I'll give you clear testing thresholds, plus a nightly routine that turns scattered symptoms into a simple, confident plan. Before we dive in, give me your full attention for the next 90 seconds. What you learn here may decide whether you visit a clinic early or months too late. Starting now. Think back to the young man I mentioned. His skin was not the enemy. It was a messenger. The roots lived deeper than the rash. First, stress and cortisol. When stress stays high, cortisol keeps nudging the immune system off balance. Seborrheic dermatitis flares. Herpes awakens. Small problems repeat, and repetition is the first pattern worth respecting. Second, lost REM sleep. You cannot repair what you do not let your body rebuild. Fragmented nights blunt natural immune calibration, so yeast and viruses gain momentum, and Monday's mild patch becomes Friday's full flare. Third, unprotected sex and coexisting STIs. HPV thickens warts and changes local immunity. HSV creates microscopic breaks and stubborn ulcers. Those micro-injuries are open doors, and open doors do not care how confident you feel. Fourth, delayed testing. Men often say, "It's probably an allergy. I'll wait." Waiting turns a simple question into an expensive mystery. Testing turns a mystery into a timeline and a plan. None of this is just age. It is a disconnect between daily habits and biological signals. Most men do not lack willpower. They lack a clear map of what to watch, when to act, and how to speak to a clinician. Here is my rule of thumb. If a skin issue recurs, spreads, or resists reasonable over-the-counter care, it earns testing. If you are sexually active with new partners, build routine screening into your calendar. I am not asking you to become anxious. I am asking you to become observant. Capture simple notes: location, count, and change. That tiny record turns a vague story into clinical clarity, and it shortens the distance between fear and relief. If any part of this felt unclear, tell me in the comments and write "need support." If you are still with me and ready for the next step, type "still listening." Your responses shape the depth of the guidance I give next. We have the why. Now let's expose the blind spots most men miss and replace guesswork with a structure you can use tonight. What do I mean by a blind spot? It's a place you rarely inspect, a habit you rarely question, or a signal you keep excusing as just dryness or just shaving irritation. When my 25-year-old patient returned a week later, he opened up. He mentioned flakes creeping beyond the scalp, a coated tongue after long days, and tiny bumps near the groin he had never really examined. Hidden zones hide obvious answers. Check the face folds around the nose and mouth, the hairline and upper chest for greasy scales of seborrheic dermatitis, and the mouth for thrush or hairy leukoplakia. Do not skip the groin, buttocks, and inner thighs where tinea and molluscum congregate. Look carefully at the genital and perianal areas for HPV warts that feel thick and stubborn, or HSV ulcers that heal slowly and return in cycles. Why here first? Chronic low-grade inflammation plus higher local viral activity makes these entry points fragile, so lesions get thicker, spread wider, and take longer to calm down or disappear. There is one lesion I never ignore: Kaposi sarcoma. Painless purple-red patches or nodules on the legs, feet, or even the lips demand evaluation, because timing matters and early documentation changes outcomes. Think of immunity like insulation on an electrical cable. When insulation thins, sparks jump. When your barrier thins, opportunistic infections appear. Not because you are careless, but because the wiring needs protection and repair. If you see any three of the following tonight: recurrent tongue film, spreading facial or chest flakes, stubborn warts, or slow-healing ulcers, write them down before you forget and date the note. That small act saves time, money, and peace of mind at your appointment. Bring the note and I can move straight to the right tests, the right treatments, and a plan that respects your schedule and your privacy. If this felt like a practical checklist, drop a simple comment. Noted. I'll build a one-page printable guide with clear photos and doctor thresholds so you can use it discreetly at home. You're doing great so far. Stay with me. Next, I'll walk you through the exact clinical steps I use in the room so you know what to expect and how to prepare. Grab a pen for this part because it sounds long on paper but takes just over 1 minute in real life. If anything moves too fast, tell me in the comments. 60 seconds each night after a shower under good light. Step 1. Mouth and tongue, 10 seconds. Look for a white film that sticks like paint, not crumbs you can scrape away, which suggests thrush. Scan the tongue edges for rough white ridges that do not wipe off, which could indicate hairy leukoplakia. Step 2. Face, hairline, and upper chest, 15 seconds. Greasy, red, flaky patches that spread beyond the scalp point to seborrheic dermatitis. Patchy lighter or darker areas that ignore moisturizers suggest pityriasis versicolor. Step 3. Groin, buttocks, inner thighs, genitals, and perianal area, 20 seconds. Use a hand mirror if needed. Shiny bumps with a tiny dimple can be molluscum contagiosum. Thick, stubborn warts hint at HPV. Ulcers that heal slowly and return in cycles suggest herpes. Step 4. Lower legs and lips, 10 seconds. Watch for painless purple-red patches or nodules. If you see them on the shins, feet, or lips, note the size and location because Kaposi sarcoma must be evaluated early. Step 5. The 3-word log, 5 seconds. Write 3 words in your Notes app. Location, count, and change. That micro-record turns fear into a plan your clinician can act on. When to test or see a clinician. If a problem recurs twice or more in a month, or resists over-the-counter care for 7 to 10 days, or an ulcer lasts longer than 2 weeks, book a visit. If a new purple-red lesion appears or spreads, do not wait. Reassurance you can keep. Early recognition plus the right testing timeline leads to timely treatment, and the goal of undetectable equals untransmittable. Promise delivered. The 60-second ritual is a lifelong tool that lets you speak to your doctor with data, not fear. One inside-out habit I recommend. Warm water with lemon and a teaspoon of honey supports hydration and routine. Vitamin C from lemon is friendly to skin health, and honey has gentle antimicrobial properties, but it is not a treatment for HIV. It is a small, steady anchor for better daily choices each day. If this was useful, say so in the comments and subscribe for the step-by-step photo guide next. Now let me show you why 60 seconds actually works, using real clinic data and behavior science. Don't stop now. If you miss this part, you'll never believe how a 1-minute ritual changes outcomes. Back to our 25-year-old, what he did, why it worked, and how to copy it. First, habit science. A 60-second micro-habit lowers the barrier to start, so you show up daily. Daily reps create pattern recognition. You stop treating each flare as random noise and start seeing trends you can act on. Second, physiology. A simple wind-down routine, plus 2 slow nasal breaths before the mirror, trims evening cortisol. Lower cortisol steadies skin immunity and sets up better sleep. Better sleep calms inflammatory swings, which means fewer flares and clearer baselines week to week. Third, the 3-word log. Location, count, change. That tiny note converts a vague story into clinical data. With data, I can choose the right test, the right scope, or the right biopsy sooner, and you avoid weeks of guessing. Now the case. Mark, 25, kept the ritual for 14 nights. His notes showed seborrheic spread from eyebrows to chest, plus a persistent tongue film that never scraped clean. We ordered a 4th-generation test and treated the skin the same day. Follow-ups were scheduled before anxiety had time to spiral. The result? He stuck with treatment, refined sleep and stress routines, and kept logging the same 3 words. Within months, he reached an undetectable viral load, and the visible flares settled into manageable, brief episodes. His confidence returned because the plan was visible, repeatable. Consistency beats intensity. Keep it nightly. You do not need an hour or a stack of products. You need 60 seconds, a mirror, light, and honesty on a Notes app. That is the bridge from fear to clarity. I am not a magician, and I am not a myth. I practice simple, practical actions that compound over time. You can too. When the skin calms, the whole body benefits. Steadier sleep, steadier mood, steadier choices. You have the why. Next, let's look forward to what changes ripple through your life when you apply the formula correctly, consistently, and calmly. Here's what happened after the young man applied the formula. Tell me if you can feel the change in your own story as you listen. Week 1. The noise in his head softened. Tracking facts instead of fears, his anxiety dropped and sleep deepened. Morning energy returned in gentle waves, not jolts, and his schedule steadied. Week 2, the skin barrier acted like a guardrail again. Greasy facial flakes retreated, the tongue film thinned, and razor burn on the thighs calmed as micro-injuries finally healed. When the barrier holds, opportunistic infections have fewer doors to choose from. Week 3, the benefits multiplied. He kept the 60-second ritual, logged 3 words nightly, and kept appointments. Decisions were faster because we were working from patterns, not panic. That's the reverse domino effect. You nudge one small habit and the row stands back up. Less worry leads to better sleep, which steadies immunity, which reduces flares, which frees attention for work, study, and relationships. How much did he recover? Enough to say he felt like himself again, and to show it in his calendar, his skin, and his face in the mirror. I care less about the number than the trajectory. Direction beats perfection, every time. If you recognize yourself here, stay with the routine. Keep it small, consistent, and honest. I believe you can do this. If this resonates, tap like, so I know to build the next guide. Stay close because the last piece we'll cover isn't just recovery. It's who you're becoming. Here is my message to you, the one I shared with him yesterday when we met again. You do not have to be fearless to be free. You just have to be honest and consistent with yourself. He told me this, and I want you to hear it in his spirit. I stopped avoiding mirrors. I stopped Googling at 2 a.m. I started noticing, noting, and moving. That was the shift. From worry to action, from hiding to looking, from looking to speaking clearly with a plan. Confusion became direction. He learned to look straight at skin signals instead of sidestepping them, and the signals softened because action replaced rumination. Confidence is not bravado. It is the quiet cadence of small steps done daily. It is documenting what you see and acting on what you learn, even if your hands tremble first nights. With his partner, there was no drama, no blame, no shaming, just a simple pact. Talk, test, trust. They set boundaries, scheduled screening, and shared updates in calm language. Intimacy got safer and, paradoxically, closer, because clarity is the strongest lock and the gentlest invitation. When he walked into the clinic, he carried notes, not panic. He placed a clean list on the desk. Locations, counts, changes. I respected the work, and so did every clinician who met him. We were not hunting shadows. We were tracing patterns together. Think of this phase as your skin's second spring. Color returns where fear once lived. Texture smooths where chaos once etched lines. You begin to recognize your own face as a place you protect, not a stranger you avoid. This is the part where you decide who you are becoming. You can keep waiting for perfect conditions, or you can keep imperfectly going tonight. Both paths cost energy, but only one gives it back. If you want me to film a focused, region-by-region, 60-second inspection guide that is safe for education and practical, comment Guide Next. I will build it to fit real life, not fantasy. You are not alone. You are not late. You are learning your body's language, and that fluency becomes strength you can carry. If you're still here, I'm grateful. Your time and attention are fuel for the kind of health education that protects lives, and I don't take that lightly. One sentence to carry home. Your skin is the earliest news report from your immune system. Listen with a simple nightly habit, and you'll trade guessing for guidance. Here's the checklist, fast and clear. 60 seconds after a shower, good light on. 5 steps, mouth and tongue, face and hairline and chest, groin and perianal with a hand mirror, legs and lips, then 3-word log. Location, count, change. The 4 clinic or testing thresholds are just as simple. If a problem recurs twice in a month, or resists over-the-counter care for 7 to 10 days, or an ulcer lasts longer than 2 weeks, or you see a new purple-red lesion that appears or spreads, it's time to book a visit. Early action leads to early treatment, and early treatment aims for undetectable. O, untransmittable. That means a stronger life, safer intimacy, steadier days, and a clearer mind. Thank you for staying with me to the end. I respect the work you're doing for your own health and for the people who count on you. If this brought you clarity, please subscribe so we can reach 1,000 supporters and keep this education free. Each subscription is a boost, and it helps me plan the next lessons with more depth and consistency. Please share this with one friend who's worrying about skin symptoms and needs calm, not chaos. Let them borrow your clarity tonight. If you want a 1-page PDF of the 60-second checklist with thresholds, comment "Noted," and I'll make it easy to save, print, or screenshot. Your skin speaks early. Keep listening.